Growing pains. Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. In this week's quick video, I would like to discuss the term growing pains. My handout for this week is Adolescents and Back Pain at Optimal Health University. And so what I did was I just did a little searching online to just say, if someone did a Google search for growing pains or back pain in children, things like that, I wanted to see what would show up. And I love using the Mayo Clinic information because it's a well-known name. People are comfortable with it. Usually when you use that name, people feel that it's a valid source of information. Another one that comes up a lot is WebMD. So I pulled a couple of things off there, so I'm going to be referencing these. For the diagnosis of growing pains, typically when you read about it, both on the Mayo Clinic and the WebMD, they talk about mostly pain in the legs. So with pain in the legs, that's not the same as low back pain or neck pain or shoulder pain. So understanding when looking at growing pains, typically they're referring to pain in the lower extremities. And that was both on the Mayo Clinic and the WebMD. So Lifestyle and Home Remedies on the Mayo Clinic website came up with these things. Number one was simply if this is a new thing and it's happening, one would be to rub the child's legs or massaging their legs, or myofascial release to the legs. And that's one of the reasons why I have a massage here in the office, is because it can be so beneficial for people, not only physically but mentally to be getting the massages. Number two would be to use a heating pad. So if their legs are sore, their knees are sore, put a heating pad in that area, just like an adult would do. If you're feeling achy and sore, you're going to put heat on that area. Unless, of course, it's acute trauma, then you're going to use ice for 10, heat for 10, ice for 10 after the first 24 hours. Next, they talk about stretching exercises. So if your child is tight and sore and some of that tightness causing pain, stretching can be very beneficial. Another one they talk about is trying a pain reliever. And of course, as a chiropractor and with what I've been doing, the videos we've been doing the last couple of weeks, I try to stay away from pain relievers, of course, but this is just what they have here. And they talk about giving them ibuprofen, Advil, children's Motrin, or acetaminophen. And they do make note that you should avoid aspirin. For those who don't know, there's a disorder called Rise syndrome. It's a rare but serious condition linked to giving aspirin to children. So again, it's like, an aspirin a day is okay. It's like, no, there's certain contexts where certain medications are not good. So just something to be aware of. And if you want to look that up, it's REYE', Rise syndrome. Next, in the WebMD, they talk about almost 2 of every 5 kids gets growing pains. So in my math, that's 40%. If you got a couple of kids, more than likely you're going to experience one of them having some type of growing pains. And it says here, it usually makes their legs ache, mostly in their thighs, calves, or in the back of the knees. So that's kind of, if they're waking up and saying my shoulder hurts or my neck hurts, that is probably not growing pains, okay? It's not talked about on either of these articles at all. The next thing, number 4, talking about, in chiropractic we talk about joints being subluxated, which is a joint not moving well, less than a dislocation, and you can have swelling, tenderness, all types of things around the joint. And they talk about here in the WebMD, aches and pains can also simply be from the running, jumping, and playing during the day. And having 3 daughters myself, I understand. Kids run around, they're skateboarding, they're riding bikes, they're jumping, falling, trampoline, gymnastics, all these things going on. But then what I found interesting on the WebMD is they said it could be psychological issue or even a lack of vitamin D in their diet. So when I talk about subluxations, I always say there's an emotional, a chemical, and a structural components. Those are the 3 different causes of subluxations. Well, when you talk about structural, obviously, the falling down, the skateboarding, the trampoline, the gymnastics, all those things fall under structural. But even here, they say it could be a psychological issue. Well, that's the emotional component. Maybe they're stressed out. Maybe something's going on at school. Maybe something's going on at home. Maybe they're not sleeping well for some other reason. So really asking those questions when you're talking with them and listening to what the possible cause can be. And then, of course, when it comes to chemical, well, chemical is everything that goes in or on our body or we breathe in, right? So there could be a lack of vitamin D could be causing some of this, and we know, I mean, people say it all the time, they're taking vitamin D for this. They've found they had a short in vitamin D. Well, that can happen in children too, and getting blood work done and just checking to make sure and rule out other underlying conditions that could be resolved with supplementation or better eating or more sunlight. And nowadays, sometimes people are afraid of the sun. It's like, it does have some good qualities. Next, when to call the doctor. Now on the WebMD, because there can be some serious underlying conditions, so this is, if the pains come and go, the best answer is just comfort your child. And that's said by Dr. Thomas Lehman. He's an MD. He's a chief of the Division of Pediatric Rheumatology at the Hospital for Special Surgery in New York. So my guess is he didn't get that title but not knowing what he's talking about. So giving them comfort is a nice first step. But if these things recur and they're happening over and over, now we got to start to be more concerned. So when to call the doctor. Your child hurts for a long time throughout the day. The pain is there in the morning. So they wake up, they had pain at night, but it's still there in the morning. Child hurts long after getting an injury. The joints ache. And in this, they refer in here, it says she and her because females tend to have more of the growing pains. She has a fever. She gets unusual rashes. She limps or favors one leg. She's tired or weak. She's less active than she usually is. So those are some of the things they list on there that you should be concerned about. Now, on Mayo Clinic, they'd say, what can you do? So before your appointment, if you are going to see a physician, you want to write a list that answer these following questions. Where does the pain occur? Is there a certain time of day when the pain usually occurs? How long does the pain last? What, if anything, relieves the pain? Does the pain wake your child up at night or make it difficult to fall asleep? Has your child experienced any other signs or symptoms such as swelling, redness, abdominal pain, or headaches? And has your child recently started a new physical activity? So a list of things to try to help resolve or figure out what might be causing this. And one of the things, now again, like kind of a worst case scenario, what it could be in the WebMD, they talk about juvenile idiopathic arthritis. And nowhere in here did I find like a percentage of that. So it's not something that, not trying to cause a fear factor, but something that the reason why you wouldn't want to take it lightly and you really want to talk to somebody. And growing pains do not involve swelling or pain in the joint. That's what it says in here as the biggest red flag. Let's see. If it is juvenile idiopathic arthritis, the knee will swell and stay that way for a while. The disease can also cause fevers and rashes. Then they also know in here, most of our current medicines can prevent or limit further damage, but they do not reverse the damage that has been done. That's why it's important to not ignore this if it does continue to go on and you are noticing some of these more severe symptoms. So just making sure that you're listening to your child. And again, they get bumps and bruises, they get hurt, they have things going on. But, looking at their emotional condition, looking at their chemical, what are they eating? Are they just pure sugar all the time? Sugar is an inflammatory agent. So you want to make sure that they're getting good dietary, getting their dietary needs met, looking at the vitamin D. And if something is persisting, please get your child checked. We all know that we would probably lay down and give our lives for our children. So we want to make sure that we're listening to those signs and symptoms. And remember, Title of my book, Pain is Fantastic. Not because it's fun to be in pain, but because pain is our body's way of telling us something's wrong. So if you've got something wrong, please get checked, or if your child has something going on. Have a great week.